The Ghana Federation of Disability Organizations wants government to set aside a COVID-19 vaccination quota for its members. According to the association, inaccessible information and having difficulty in meeting specific requirements of people with different types of disabilities has hindered many of its members from being vaccinated against coronavirus.
3% of Ghana's population have a form of disability, according to the World Health Organization. Ghana has so far administered over 900,000 vaccines, but there is no data on how many persons with disability have been vaccinated.
We have the list of all the people living with disabilities throughout the country, but I cannot tell until the exercise is over.
Our checks at some vaccination centers revealed that Pwds only make enquiries without getting the jab. According to the Ghana Federation of Disability Organizations, its members have several concerns.
These times where persons with underlying health conditions is a concern because they are more susceptible to the virus and would find it difficult recovering, it is important that some of these interventions are placed for persons with disabilities so that we don't lose lives when it could have been prevented. We are calling for some preferential treatment when it comes to persons with disability.
But the Presidential Advisor on Health, Dr. Insia Asari, disagrees.
What we didn't do is that we also didn't want to hear target disability, go to this place and go no. So the plan is that if you are a person living with disability and you fall into the 43 districts, they were all captured and covered.
He entreated all persons with comorbidity to take advantage of the vaccination.
So this vaccine that we've been talking about has no effect on any part of the body, and for that matter will worsen your disability. Right? Whether you are a person living with a disability, it has nothing to do with your disability. It has nothing to push you into further disability. So I will entreat everybody that when it comes to your doorstep, go for it. It doesn't matter whatever you are, especially if you are a person living with disability and you have a comorbidity. It's a comorbidity that can kill you.
The WHO, in its disability considerations for COVID-19 vaccination relief, urges governments to take into account the vulnerabilities, risks, and needs of groups who, because of underlying societal, geographic, or biomedical factors, are at risk of experiencing greater burdens from the COVID-19 pandemic. As of June 2, Ghana had recorded 49 new cases of COVID-19 with an active case count of 1,169. Recovery and discharge stand at 92,057 with 785 deaths, while total cases recorded is 94,011.